Hi, my name is Dr. Winston Morgan. I am a reader in toxicology and clinical biochemistry. I also do research and write articles on the impact of race in higher education and health outcomes. Today, I want to explain why seeing the COVID-19 deaths through the prism of race is fundamentally flawed. Once the death rate started to come out, it was suggested that a person's race was a key determinant of their chances of dying from the pandemic. More worrying was the fact that neither the scientists or medical professionals were able to provide alternative explanations. I noticed that the media were using race, which is a socially constructed concept with no scientific basis, to explain the impact of the coronavirus, which is a very dangerous thing to do. At the time, the impact of the virus was being used to redefine what we understand as race, effectively giving race a new scientific credibility, which can be a very dangerous thing to do. This misinformation was both confusing and suffocating the real discussion around the role of structural racism, which is probably more important in this context. My aim was to separate the science from the myth of race and allow that discussion to take place. Now, people racialized as black have enough to contend with without being forced to accept the extra burden of COVID-19 as being down to something inherent in them, effectively something in their genes. Another reason to challenge this narrative is that in the future, this new interpretation of race could provide a cover for direct and indirect discrimination. If it is accepted that certain racialized groups are more susceptible to the virus, then employers can use this as a pretext not to employ or even to restrict what certain racialized groups can do in the workplace. We have already seen this suggested early on in the pandemic by certain NHS managers. But how accurate are claims that your race or even ethnicity can determine whether you were more likely to be infected and die from the virus? Is susceptibility really linked to specific genes which determine a person's race? Or could the explanation be found in the environment or other social factors brought about by structural racism? Now, in a multiracial and multi-ethnic society, we are frequently required to identify ourselves in terms of race and ethnicity. This results in everyone being viewed through the prism of race. But racial categories, as we know them today, as I've said already, were constructed many years ago, and they're full of scientific contradictions, if you like. So the idea of separating humans into distinct groups or races was primarily popularized, if we like, 100, 200, 300, 400 years ago to justify colonialism. Now, despite these questionable origins, a person's race is now treated with unquestioning social and medical certainty in many cases. Many professionals who use race in their work have no idea of its origins. So this acceptance of race as a reliable descriptor can also be seen on government-sponsored medical websites, where certain racialized groups are described as being more susceptible to non-fatal but life-threatening conditions like type 2 diabetes, heart disease, high blood pressure, that kind of thing. Now, this artificiality, or the artificiality of race and ethnicity, remember it is an artificial concept, particularly as it applies to biological outcomes, often leads to confusion and contradictions. Race, if we remember, is defined by a limited number of physical characteristics, and these are arbitrary, primarily skin colors, hair texture, and facial features. Ethnicity can be linked to language, culture, and religion. To complicate matters, many of these determinants transcend both race and ethnicity. For example, if we look at groups which are categorized as Asians, they possess the full range of human skin colors, which is one of the key determinants of race. Yet, they also belong to the historical racial category of Caucasians, which also include white Europeans. Similarly, language, culture, and religion may be observed across different ethnic and racial groups. Now, let's look at the ONS, the Office for National Statistics. The Office for National Statistics categories used for COVID-19 death rates uses a combination of race, religion, and ethnicity. And this reveals differences which undermine the notion that infection by the virus is dependent on genetic links, if we think that race and genetics are linked. Groups identified as Indians, Pakistanis, and Bangladeshis, which are normally categorized under the same racial groups, are also, if you like, using the same populations for genome-wide association studies. These are basically genetic studies that they group different populations with, have very different outcomes. Looking at the ONS data, males who are more affected by the virus for reasons which we do not fully understand this data reveals that those categorized as black are over 4.5 times more likely to die from the virus compared to what their white counterparts. Then we go down to Pakistani Bangladeshis, which are grouped together, and then Indians, which are only 2.5 times. So there's a big difference between Pakistanis and Indians, as I've said, and yet they belong to the same groups. So the chances of dying from the virus is significantly also linked to comorbidities such as diabetes and obesity. And they are both higher in certain racial groups, including those who are most affected. But there is evidence they are the result of structural racism, not race. All these underlying problems can be directly connected to, for example, the food and exercise you have access to, the level of education, employment, housing, healthcare, economic and political power within these communities. So if you lack all of these things, then you're more likely to have certain kinds of deprivation, which is more associated with the impact of COVID-19. So the evidence suggests that the coronavirus does not discriminate by race, but highlights existing discriminations. We must always remember that racism comes from race, not the other way around. So first of all, you have racism, and then people, if you like, categorize people into race to explain it. So without racism, race has no relevance and does not really exist in any meaningful way. But as long as society continues to view the world through the prism of race linked to genetics, we do not have to deal with the problems of racism and the structural problems it causes within society. However, just to finish off, there is hope, as the BAME COVID-19 review published by Public Health England has just reported. This was a government report which wanted to basically find out why are so many BAME people affected. It made 7 key recommendations, all of which directly or indirectly point to solving structural racism as the way to reduce this disproportionate impact of COVID-19 on BAME communities. So if we follow the recommendations, we have a good chance and we wouldn't see these disproportionate effects.